currently Sue's birthday and what did I say?
Yeah.
And we need to approve the minutes from June. Can I have a motion for that?
Move it.
Second.
Moved by Carlo, seconded by Petrus. Any discussion? All in favor?
Aye.
All opposed? Okay, appointments, none. Just as a scheduling note tonight, Sue did ask, she has some birthday party planned tonight that none of us were invited to. But she did ask to go first for that, and we also have the college on that wishes to, go first, but we're gonna allow Sue and then the college, and go from there. So Sue, you are up.
Okay, I did quite an extensive report, because there's a lot going on, and I think it's important to have all the numbers, for you, so we're very busy. I did want you to know that anybody who had an appointment that wasn't able to come in to do the oath of office received a letter, and they are coming in, making appointments to come in and, doing the oaths of office. I got a couple of you that probably can just come into my office anytime. I know I gotta bring my book up, and I wanted to bring to your attention that I think our historian was very honored to be asked to do some of the reading, Frederick Douglass's reading about his historic speech about the 4th of July and slavery. So she was only one of 2 people in New York State that did that reading, and that was pretty amazing.
It was awesome.
Yeah, everybody's working hard, you can see. Let's see what else. The appointments are working great for DMV and the county clerk's office. The public is very happy about the appointments. We got tons of good reviews. We're 5 out of 5 most of the time. And, that's going so well. Another, we had 8 transactions, now we're adding registrations, any kind of registration issues. And when we get the rest of the staff back, probably we'll be doing, maybe adding licenses. We'll see how it works out, but so far so good. And, a lot of the responses are, we felt safe in there, things like that. Our Elvis is a big hit. We got the Elvis, right? So I think that's the way to go. And the same with our office. We do get called out front to do some notary services where, if somebody did make an appointment, we're going out front to do it. We do keep a log of that. So that's another thing. But the way to go, the online appointments really lets us keep a log too. We just write down if something's added to that, because we want to be able to have tracing in case somebody gets sick. So other than that, we've been doing a lot of transactions. There are like 3,600 transactions in June, and in the DMV, and a ton of land documents, land and judgments and things like that. So as the courts open up, and if you ever come in to see a Wasco Abstract or Stewart Title, they have stacks and stacks of documents, land documents to do. It's a really good sign for the economy. People are buying and selling houses, getting mortgages, all of that stuff. So I think that's about it.
So, we'll open it up to questions for Sue. I know one question that I did have was for your recording office. Year to date, you have about 300,000 in revenues. You have it projected for like 640,000 for the budget. So you're pretty close to being on track for that, to make that mark.
So far, so good. I think we are going to catch up. You never know. But if people keep having confidence in the economy, and again, it's all about that. So do they feel like they can buy a house? Do they feel like they can take a mortgage? Do they want to do home improvements? The attorney's offices have opened up, so I think everybody's really busy now, so I'm hoping that's the case, right? Yeah.
And are you seeing the same thing in the DMV?
DMV is, yeah, it's youth committed to there's, today we're working on June 26th. That's all you need to do is go to bed in the plate room in our back room there and see what kind of, there's just piles and piles of, stacks of things to do. But, we're doing our best. So I do see that, yeah, people are selling and buying cars, just like they're selling and buying houses, so tons of people. And then you've got people who don't purchase a car, they lease it, and their leases come up. So every 2 years, you get a ton of that, and that's going on too right now.
I have Elaine and then Trish.
I'm sorry, Trish can go first, she got the commission.
Okay, go for it.
I just had a couple questions. Thank you for providing all the numbers and the services that you guys are doing. And I see your Facebook post about the changes in services and things, and thank you for promoting that.
I have a lot of new friends.
A couple questions with the DMV, the June revenue, how's that compared to like last year? So,
I think it's down from last year, for sure. I don't have that number here, but I do know it's down. And that probably has to do with it's starting a little bit later. Some people still today actually think the DMV is closed. You can go out, we could have a hot air balloon over Auburn in Cayuga County and announce it, and people still would say, you're closed, right? It's crazy, but, and I think again, it's just slow in picking up, but I think it's going to be a good number overall.
okay.
Yeah.
My other question was regarding the online revenue sharing. Year to date was 8,500 and June was 5,400. Is that typical?
So that's a really weird thing about the state. So when the state decided to go online and not allow county clerks to process anything online, because believe me, we tried, somebody even had a system to do it, and they forbade us to do it. So what they did was say, we're going to make you okay. And they gave us a certain amount. So when we reach a point where so we know exactly how many people go online for our own county. They give us a portion of their online revenue. They give us a portion of that. So when we get to a certain point, they start giving it to us. They just started giving it to us. It's earlier than normal.
Okay.
And that's because more people went online because we weren't open for everything. So people went, I'm doing this, I gotta do it. And, somebody stops me, I'm gonna, So we are in negotiation with the state about what that number looks like. We're always trying to make it a little better, things like that. But at this point, that's not looking too good. So that's why it's kind of small. It'll keep getting bigger and we'll keep getting more. I forgot what the total is going to be, but that's what they do every year. They give us some money. And it started, like I said, sometimes we don't even get any money until October.
Okay. I didn't know if it was,
Yeah.
we were
And I
further
don't know
ahead
that
than
number,
normal.
yeah.
Okay.
So it's nice they give us something, but it's really just, pittance really
Gotcha.
compared to the work we do.
I feel like we might see that number increase. at
Oh,
some
yeah,
point
that's going to increase. Yep.
Because of the online transactions that happened while the DMV was partially shut down. So
Yes.
maybe we're hitting it now early.
Yeah, they have a modernization plan, and they will be doing more online. I really think that they've been working on that all along. You might see some kiosks going up or something like that. It's all about online. We get that, but there's about 45 things that we do that they can't do online. So people do have to come in, but we'll see how that works.
And Elaine,
Just because in my mind, this is how I think about it. I know you do a lot of tracking of the revenues, especially for DMV.
Yes.
And if the revenues are less than the year before, based on furloughs, whatever. So would your expenses though too. So in the end, that revenue compared to your overall expense, that shouldn't be as huge of a hit.
Well,
Budgetary-wise.
I hope you're right. I think so, right? Because those salaries aren't there.
Right.
We're gonna have a retirement. I think so, Elaine. I think it might just even out, but, you know, we're always looking at the revenue, that bottom line revenue, not so much the expenses. So
But-
it's a good way of looking at it.
Yes,
because,
so I mean, if those revenue projections, or the expenses were still up and the revenue was down, it'd be even
Yeah.
worse than the picture.
I don't know, though, you know, we are working a ton of overtime, and that could,
That
that
might
could
be a good way
offset
to
it.
look at it then too. expenses,
yeah,
right?
yeah. So I'm not sure.
Okay, any other questions for the clerk's office? Hearing none, thank you so much, Sue, happy birthday again.
Thank you. Thank you. I
Next,
appreciate being able to go first.
yes. All of college and, you know.
Happy birthday.
Happy birthday, Sue.
Brian, are you on?
Yeah.
Oh, he's still frozen.
I'm here, yes.
Okay, great. Can I have you kind of, give your overview on the two resolutions you have, and then maybe we can get them moved by a few legislators.
Yeah, sure. So I'll first talk a little bit about the budget, and I'd be happy to answer questions, and I'll try to give an overview of our assumptions and an overview of what is in the resolution. I know typically I would do a more comprehensive PowerPoint, and perhaps if there's if there's a necessity and a need, I certainly am prepared to do so, given the unique environment. I've chosen to kind of go off the resolution today and along with my ask. So ultimately what's in front of you is a resolution on the, well, right now I'm looking at the Faculty Association. So you want me to start there?
Yeah, that's fine, and I don't mind these being, these overviews being very brief. It's just to kind of get the.
All right. So in the Faculty Association one that's in front of you, this is a successor agreement to the current one that was about to expire here at the end of August. We, certainly with our work with our Faculty Association, our trustees, we reached a tentative agreement. That agreement is a 3-year agreement. The primary highlights of this agreement is really based on 3 main tenets. The first one is that in each of the 3 years, we have agreed to a 2% increase just to base salaries, with no other financial increases to any of the other components of the contract. Now, for those that are a little less familiar with faculty and faculty contracts, what I would just point out is that there are a number of other components of the faculty contract, such as overload and longevity and other aspects that there are significant dollars and wages in those areas. And each of those items are frozen for the entirety of the 3-year successor agreement. So the 2% that's in this agreement is just on the based wages themselves. The second main piece of this particular agreement is related to retiree medical. And so in this, the retiree medical agreement has that all future retirees upon the age of 65 will go to a supplemental advantage program. And that program is one that provides significant cost savings to the institution over time, to some of our future liabilities, as well as provides us with, some relatively near financial relief, if you will. And the third main tenet to this is that we are going to agree, and which is similar in other contracts that we've had, and I'm sure that you're all familiar with, to engage in a labor management committee to talk about some other structural and language components of the contract at a later date. And so I just felt that one of the reasons why I advocated for it for you, I advocated to our college trustees, is I think to be able to have certainty of what the, around the financial parameters given these uncertain times is a good thing for our institution. It's a good thing for our employees. And ultimately, I'm going to ask that you support this successor agreement for, the next 3 years.
Okay, great. Would anyone like to move GO1?
I'll move it.
Moved by Tricia, seconded by. I'll second it for discussion. Any discussion on GO1? All in favor?
Aye.
Aye. All opposed? Okay, GO1 passes. Moving on to GO2, Brian.
Great, thank you. So what's in front of you now is our operating budget. And our operating budget for 2020-21. This budget, the highlight for the county that we want to leave you with two main things is that the approved 2019-2020 budget is approximately $29,700,000. And I gave this update in the recent ledge meeting that when I brought this budget to you after passing through our trustees, that we have already cut our budget from 29.7 to 28,570, which is the number that's in front of you in our overall approved budget. And one of the components in that, based on our assumptions, is that given the realities of the world, I have made the recommendation to our trustees to not ask the county for an increase of sponsor share this year, even though we could very much use it. Obviously, we're cutting our budget. We understand that there's more unknowns than knowns. And to be a responsible steward with you, we felt as though that for this year, we would not ask for an increase of county support. We're very grateful, and I'm very grateful for the increases we've received over the last few years, very much. And ultimately, this budget represents a cut from 29.7 down to 28,570, and a flat or $0 increase or maintenance of effort from you as a sponsor. And that's what's captured in the resolution.
Okay. If we could have someone move GO2.
Move
Moved by Charlie, seconded by Pinckney, if I heard that correctly. Any discussion? Tricia?
I was wondering if you could just talk a little bit, I think you mentioned this at the last meeting, but talk a little bit about your expectations with regard to student enrollment for the upcoming year, and even online classes versus in-house classes and what you're expecting.
Yeah, so thank you for the question. So in the 1920, we built our budget off an FTE of 2280. And I'm pleased to report that we exceeded our enrollment goals for this year, even given the uncertainties that existed. And right now we're about 2310 for our year. And I'll be able to give a final update in a few weeks, around September 1st. But we know, even before the pandemic, that applications for the college are down, the demographics are shrinking across the state, and the applications for colleges across the state in general were down. When the pandemic hit and more uncertainties emerged and the fully online in the spring, I chose to create this budget to actually be built on only 2,000 FTE, which would represent, I think another 12% or so, 13% or so of decline in enrollment. And so we are trying to be realistic yet conservative. And ultimately, we're tracking in that area at this point for the fall semester. But there's so much unknown with what student choice will be, particularly in August, given the other variables and components for other institutions, reemerging back to college, and so on. So we felt it was very important for us as an institution to build our budget in a realistic yet very conservative way. And we've been fortunate in recent years to be able to be within about 1% to 2% of each of our enrollment projections. And although there's anomalies in this year, certainly, that's how we built and constructed this budget. We also, I'll just add, and I alluded to this in our previous meeting, we anticipate state cut in aid that will force us to make additional cuts. But we have to get our approved budget with what's already been enacted, and that's what this represents. And then as other decisions from the state, when it comes to allocations get made, then we will respond accordingly. As for our plan for the fall, and we can make sure this gets sent to you, we may, in a press release in our plan, I made the announcement earlier this week that our intention is to only offer about 15% of what we typically offer face-to-face, and 85% of what we typically offer will all be done remotely through multiple different modes of delivery, including completely online, synchronous and asynchronous delivery, interactive video, and others. Our primary focus on campus will be for applied technologies, clinicals, and other hands-on things that are important for learning. But our services will be available to students as long as it allowed face-to-face, and we'll continue to work with our local officials and state to meet all the compliance based from the guidelines.
Great.
Thank you.
Any other questions about GO2? Elaine?
I just was curious, Brian, does this impact your culinary program in any way?
The culinary no. All of our costs associated with the culinary program are included within this budget. The culinary program has been impacted slightly in the sense that there was, a holding of construction that could occur for a period of time. However, we're finalizing the updated schedule as we go forth, but we're looking at alternative arrangements to be able to begin our culinary program in facilities that exist within our community to be able to get it up and running. We do have over 20 applications for that program at this point, and we're nurturing those contacts even in this moment of uncertainty to try to get the program off the ground. And we're hopeful that by the time we can get up and going, working with our partners, that the culinary facility will be able to be open by December, the spring semester. So certainly what happened in March and April had delayed us, but ultimately we're confident that it'll get done as quick as possible, and it's still part of our strategy.
Trish?
Can you just give a quick update on the Workforce Development Center?
Yeah. So one of the things that we're working on right now that I will have a more comprehensive update for you probably as early as the July meeting is some of our approved projects for SUNY Capital are part of what's being reviewed for what could be allowed for new construction projects to begin now versus later. And I know that I know that Chris in the county attorney's office is going through the agreements and working through things, and we're confident that the acquisition will happen, in a short time. But ultimately, our ability to move forward on the construction may end up being impacted by availability of funds for a temporary period. So that's something that we really hope to be a 2020 project. But given the changes of what may or may not occur on allocation of funds from the state to match the local funds we've already identified, it may end up having to be delayed just because of uncertainty for the availability of construction funds. And so as we get more definitive answers from the state, then we'll be able to update our timeline and our vision there. But it's still very much an important project for us and one that we will see through as it allows.
Thank you.
Okay. Brian, can you hear me?
Yes.
Okay, great. Any other questions about GO2? All right, all in favor?
Aye.
Aye.
Aye. All opposed? Carried. Thank you so much. We'll see you for the full Edge meeting.
Great. Thank you all. I appreciate it.
Next up is, and just as a reminder, we do have a executive session tonight, and that is for contract discussions. Yeah, so I just wanted to be clear on that. Next up is Cheryl and Kate. Are either of you on? They're probably up to their eyeballs in ballots. Okay, so I'll just give a quick update. They had me in for their audit that they had on some of their ballots, and they showed off the new machine. They had a reputable company there, and they showed off this new machine that they purchased with the CARES funds, and it's like a $50,000 machine. It almost looks like a printer with a computer attached, and it's maybe this big, and they can stick in like 500 ballots, and it spits it out in, I don't even know what it was, 2 minutes or something, and it counts every single vote to make sure it matches the tape that they have from the election day that they received. If there's any half printed circles, this machine pops it up and you can scroll through all of the ballots that are like that and so they can see it right in a digital format. And it's really incredible. They can break it down by district, by vote. So I thought it was really neat, and it saves them a ton of time. And they have this rep that can come in and help them with any of their issues for the next 2 years, I believe, as part of the user agreement that they have. So, and they didn't have any issues that day. It was spot on 100%. That's what's supposed to happen, but it will save them a ton of time. So, and they're still counting. I think they're still counting last I heard. So, yeah, if there's any questions for them, please forward them on to me or on to them, and we'll get them to the correct person. Next up is Sheila.
Sheila submitted her report. If you have any questions, you can let me know.
Anyone have any questions for Amanda or Sheila's office? Hearing none. Any updates that you have, just that you want to include besides what's in the report?
No, I think it's pretty covered. I'll be coming in on the following week. Sheila will be out next week. And then I'll be coming in like 2 days a week. And me and her will kind of go back and forth with that and figure it all out.
Wonderful. All right. All right, Amanda, thank you so much.
No problem.
Next up is Chris Palermo.
Well, the month has been fairly typical for the pandemic type months. We've been processing contracts. We've been assisting departments, more than usual. The health department, we usually don't hear from them quite this often, but given the current state of affairs, it's necessary. We have a number of matters in litigation, several large projects that we've been working on. Rich Graham's been very helpful in several of these areas. We had a subdivision meeting last week on the property at County House Road internally. We've got the property transfers you heard Dr. Durant mention. A number of larger unique items, non-routine. Of course, Brittany's been working real well with Joe, taking over a lot of the JD cases, processing FOIL requests as usual, county attorney work.
Any questions for Chris or his office? I do have one. Chris, last night we heard from the DA's office that Brittany was working for him in some capacity. Can you just?
Sure, yeah, happy to. So during the initial period of the COVID crisis here, we had fortunately Mr. Bizzari here, Tim Brennan, one of the social services attorneys. Without so much court time, he was able to give us a hand processing a lot of the contracts, routine contracts, something that normally Brittany would do. John, I had mentioned to John early on that if he needed any help, he was short-staffed. We had a couple of empty positions. Let us know. We do what we can. It kind of worked out real well with Mr. Brennan being able to assist with some of Brittany's work, that she could help out with some of the discovery going on over in the prosecutor's office, which again tied in real well on the criminal side to her work on juvenile delinquency. As you know, she was just admitted, so any experience she can get is valuable. Really was a fantastic opportunity, both in terms of training on our side, to be selfish, I guess, and to help the district attorney's office in processing an awful lot of discovery. So, one of the bright spots in what was otherwise a mess.
Great. Any other questions? Chris, thank you so much.
You're welcome. Expecting that. Oh, there you go. Look at that.
We are going to flip it around a little bit. We're going to have the Veterans Office go and then Paul last. So, Lindsay, are you on?
Just stop sharing the screen.
No, it just completely went out. It's not reach. sharing it.
Okay. Then we'll have Paul go. Paul, are you on?
I am on. Yes, I am.
All right, great.
Oh, okay. Well, thank you, Mr. Chairman. So I've submitted my report. The two areas I'd like to highlight today are the two most critical to us from a work effort perspective. One is the work we're doing with the New York State Board of Elections and the local county Board of Elections. We are reviewing a cybersecurity grant from New York State. I'll be working with the County Board of Elections team next week to submit our initial budget and plan for remediation of what New York State feels are security risks. They did an assessment in 2018 and 2019, or actually I think it was 2017 and 2018, and then gave us the report in the end of 2019. Of course, during those 3 years, IT has made a lot of changes in security and improvements. So a lot of their information was kind of outdated. But nevertheless, they found specific issues that they were concerned about, and they have asked us to come up with a remediation plan. They've asked every county to do that, and we've been working with all the other counties and kind of benchmarking how each county is doing that. So we'll be submitting our proposal to New York State, and then also submitting for a resolution next month to accept grant funds that were allocated to Cayuga County. It's about $80,000 that we've been allocated out of that grant. Our plan is greater than $80,000 as far as what needs to be done, but some of that money has already been spent this year or is in our budget for this year in IT. To remediate security. So I think we're on track, but we're going to be working with a consultant from New York State to kind of finalize that next week. And then the other item is, again, just as a reminder, we've talked about this many times over the last year, is that our most of our multifunction printers are up for renewal. Their leases are up in October. So we are looking for some direction, and I've been working closely with procurement and the county attorney's office. We're looking at glomming onto either a grant, or not a grant, but a contract with Onondaga County with Toshiba, or possibly with BOCES and Xerox as two possible contenders for competitive products. And again, most of our devices are due to be replaced in October, so therefore we really need to push through an approved process sometime in the next month or two, so that we have all the equipment coming in times to replace the gear that is going to be off lease in October. So we'll be working closely with the with Aileen and the rest of the team to in the county to find the best possible price and come up with something that will work for the whole county from a feature function point of view. At the same time, we're working with Lynn Marinelli to reassess with departments whether or not they need all the devices that they have. So we're looking closely at that just to make sure that we're not overly zealous in the number of devices people have in the county, to make sure that we're not spending more money than we need to spend. So we're looking at closely tightening the reins on the budget wherever possible, from cell phones to county printers to anything that costs a lot of money to operate. So those are the key things that I mentioned in my report. Are there any other areas that you'd like me to focus on?
I mean, not at this point. Just a point of clarification. So prior to this meeting, we had the IT work group committee meeting. Paul did bring up the multifunction printers that he's planning on working with Don, and he was looking for some direction. And I said, committee, there's a lot of steps that has to happen before it comes to committee. So I advised him to sit down with Aileen and just work through that process, and then they'll eventually bring something up to GovOps for whatever direction they figured out was best between BOCES and Xerox or Onondaga County and Toshiba's. So it's a work in progress. If there are legislators that have questions, I mean, feel free to ask him, but it's a work in progress right now, so go from there. Does that about sum it up, Paul?
That's very fair. Thank you, Ryan.
Yeah, okay. All right, so any questions for Paul or otherwise? Tricia?
On your report, you talk about the T-Mobile Connecting Heroes program. Can you talk a little bit about that?
Sure. So T-Mobile has a program. When they made the acquisition of Sprint, the things that they had to give up to the federal government were a number of programs. They had to sell off a number of businesses. One thing they decided to do to incent the government to approve their merger with T-Mobile was to give away free telephones and services to our first responders, which in the case of the county, that includes the sheriff's office, 911, and potentially the emergency management office, and also any firefighters that work for the county. We don't have any firefighters that work for the county per se, as part of the offices. The 911 center does not have any cell phones in their department, and so really the focus is on the sheriff's office. Again, T-Mobile is offering free service. We met with the sheriff and Denise and Amy and anybody else that was interested about this, and we talked through options. What we decided to do, we piloted T-Mobile last year. IT did, and we found that the coverage was good but not great in every area. It was different than Verizon. So some areas where Verizon has poor coverage, T-Mobile had great coverage. Obviously, we want the county sheriff's office to have people who can access their phones wherever they need to. So what we're deciding to do is we're going to pilot a couple of phones in the county sheriff's office, if T-Mobile will let us do that, and see how they work. If they have the good coverage, then we might look at saving the county money by replacing some or all of the sheriff's phones on Verizon with T-Mobile phones. So again, we're moving from a cost of about $40 per month per device to zero for T-Mobile. But again, the coverage, the coverage may not be as complete as it is today with Verizon.
So is that program, is it open to like volunteer fire companies and like other municipalities, or is it specific to the county?
It's open to. It is not open to. It's open through volunteers if they're willing to give up ownership of their cell phone. So they would have to go to they have to be staffed by a municipality. Any municipality can do this. It's not a county thing. So my understanding, I'm not an expert in their program, but the way I understand it is that from a county perspective, these folks have to be working for the county, or the county has to be the sponsor for them. So if you were a first responder and had a personal cell phone and you wanted to stop paying for it, if you're on a family plan, you'd have to break the family plan up and you'd have to give us the phone number and move your phone number essentially to a county-owned phone number that would be through our contract with T-Mobile. Again, it would be a $0 contract, but it would be under our contract.
Thank you.
Yep, sure.
Paul, one of the things that we also discussed was Munis and how that's being upgraded and the work that you and Mary Beth are putting in, which is tremendous. Can you just give us a brief update about that and where you are going with that? Because there was
Absolutely. Yeah, we absolutely have to upgrade our Munis platform, which is our financial system. It will not work for us next year, so we have to do the upgrade. Some of the reporting will not work for New York State. So we are pushing through the upgrade process with the company Tyler, who provides it to us. There's essentially no cost for the upgrade, but we are paying for some professional services and training for the staff so that we get to use the upgrade features, the changes to the product as best we can. So the professional services team is implementing the changes in the system. We are working with them in IT, as well as working with Mary Beth's office, with the treasurer's office to basically train the trainers. So our IT and Mary Beth's office will be trained on aspects of the new system. Our first training class is actually tomorrow morning. So IT is responsible for the operation and assigning user rights to Munis, and Mary Beth's looking at the business process and how things are going to work for the county departments. She's organized a very organized training process for rolling training out to the departments in the county, so that they get to be familiar with the new features before we turn them on in the production environment. And the goal is to do that before the end of the year. Certainly, we're thinking it's probably going to be in the September timeframe, but our timeframe is totally dependent on the availability of Munis folks, part of their professional services to implement the changes that happen in our environment, and then for us to configure things the way we want to configure them, and that being Mary Beth's team. So, with the support of IT. So it's a combination of the treasurer and IT working to get this defined and rolled out, and then deal with the changes. Some of the changes include things like a new check system. So we're printing checks slightly differently. We've ordered new paper. Mary Beth's ordered new paper stock, and so the forms relating to purchase orders and checks has changed. And so those things are going to be tested over the next couple of weeks. And then again, people will be trained on the new system. And then whenever they decide to cut over, we will cut over to that new system, and one step at a time. And then we'll also upgrade all the other software that is involved with running Munis. So a number of changes that will impact anybody that uses it.
Great. Any other questions for Paul before we move on? All right, thank you so much.
Thank you. Appreciate the time.
Next up, I just want to make sure that either Jessica or Lindsay is not here for the Veterans Office. Okay, so we do have a need for an executive session for contract negotiations. Can I have a motion for that?
Motion.
Motion by Charlie, seconded by Trish. All in favor?
Aye.
Aye. All right, there is a separate channel for that I believe Chris Palermo sent out.
I'll go see where it is.
Yeah.
Are we here or are we done?
We're gonna go into other.
Okay.
I'm in two. You did that several. That's right.
Yeah, I haven't had a chance to go through it yet, but I will. And, no problem. Still looking for reference number.
Chris, I told you to talk
Tucker has it, I
about the
think.
video too much. All right, that's good to know. We should, I mean, this really should.
Yeah.
Cool.
Did give everybody.
Gonna move on.
She gave everyone these delivered.
See the ones
They're just.
Brittany?
Yeah,
Brittany? Where is everybody?
an executive session. I was just about to ask you, are you going in there or no?
I must have gone in the wrong room. Okay. I had two by Palermo, so I must have went in the wrong room.
Okay.
Thank you.
Yeah, Paul, make sure you leave this one before you go into the other one. There we go.
Hi, Brittany, can you hear me? It's Keith.
Yes.
So is government op still in executive session?
Yes.
Thank you. Do you know, is it going to be much longer? Should I join the executive session or no?
Honestly, I don't know how long it's going to be.
Okay,
You
great.
could join in, and then if it's not long, join back out or kick.
Great. Thank you.
You're welcome.
Where'd you go? Oh, I'll run it. Right. Right. Where?
Okay. We have to come back.
To adjourn.
Motion to adjourn by Mr. Ripley, seconded by Trish. Any discussion?
Your motion to come out of executive session should be stated here so that whoever's taking the minutes can include that.
Okay. So motion by, Ripley to come out of executive session, seconded by Tricia. It was all in favor. That's good. So now we have the second one, which is motion to adjourn the meeting. That's done by Ripley, seconded by Tricia. Any discussion? All in favor?
Aye.
All right, we are officially adjourned. HHS is next.
One, two, three, 4, 5, 6. And Timmy Lattimore is not going to be here tonight, right? All right, can I go?
You can?
All right. I'd like to call the Health and Human Services meeting to order and get a motion to approve the minutes of June 11.
Move it.
Can I get a second?
Second.
Okay, all in favor? All right, great. We don't have any appointments tonight. We do have, there started out to be 7 resolutions. One of the health department resolutions has been tabled. So if no one has any objections, I'd like to go through the resolutions and move those forward. HH1 is the authorization to accept additional funds from New York State Office for the Aging into our Office for the Aging budget, $1,605. This money can be spent for COVID-related expense, and it would just supplement the current budget that we have now.
Move it.
All in favor? Or discussion? No, all in favor? All right, great. HH2 is the authorization to fill a full-time nurse vacancy in the health department. There's a retirement of a nurse coming, I think, July 9th. She said, sometime in July, she's set to retire. This has gone through the hiring committee. If this passes, we'll be able to replace that full-time nurse vacancy in the health department. For HH2. Second, okay. Any discussion? All in favor?
Aye.
Right, great. HH3 is the one that has been tabled. That's coming back to the hiring committee again on Monday, and we'll bring something forward after that. HH4 is authorizing the chairman and the public health director to extend the contract for their public health preparedness grant, except $76,098, and have that extension go through June 30th of 2021.
Move it.
Second, okay. Any discussion?
Just a question. What is this exactly? Like, is this for, what is the fund used for?
Kathleen here, but you've had a preparedness grant for years, and it helps.
So after 2001, a couple years after, the state started giving health departments public health preparedness funding. It's gone through a few iterations of name, and it's to be prepared for public health emergencies. It pays, we use it for is to help pay for some of Michelle Wonderwood's time in the planning department, because she helps us write some of our plans.
Okay.
And execute our mandatory drills. We also use it for like paying for the generator that we should have in order to keep our vaccines going. So it's a lot of practical, mechanical support, but it's also then we pay for part of our senior public health educator and public information and a few other things. There's a whole bunch of stuff and a lot of COVID stuff.
Thank you.
See, it's pretty much been flat. I mean, this is a pretty typical yearly award
This is just to accept the money, right?
and put it in the budget, yeah, so it can be spent. Yep. HH5 is, I think it's a contract renewal raise here, if I'm not telling the truth, is
You
to,
had a vote on 4.
oh, I'm sorry.
It was just discussion.
Can I get a page 4, accepting the public health grant? All in favor?
Aye.
HH5 is to renew a contract with the CAP agency. They do rapid rehousing case management services for the TANF population cases. It is 100% funded with the flexible fund, and if I'm not mistaken, it's an annual cost of $66,600, and this would be a contract renewal.
Move it.
Okay, discussion? All in favor?
Aye.
Any opposed? Okay. HH6, this is allowing the mental health department to enter into a 5-year agreement with colleges or universities to accept social work interns and or medical students.
Move it.
Any discussion?
I was just curious if this is new. Is this new, right? Or?
This is to stop us from coming up here 2-3 times a year asking for specific resolutions for specific schools. No
Oh,
money,
okay.
yeah, no money changes hands in these, we just have interns, so it just saves us a lot of time.
Gotcha. So you use interns regularly.
It's good.
You use interns. You guys use interns regularly.
Oh, yeah, we usually have a couple of folks in preceptorships for nurse practitioners, psychiatry here, and 6 or 7 social workers. First.
With multiple universities.
Yeah, Columbia, Cayuga, all that stuff.
So as Ray says, every time this happens, he doesn't have to come and ask, so. All right, did we vote in there?
No.
Okay. Can we get a vote on HH6? All in favor?
Aye.
Any opposed? Great. Okay, HH7, now this would be to amend the mental health 2020 budget to show the purchase of the IT equipment. And, okay, great. You're just moving it from the IT budget into your budget, so you,
We can claim.
yes. All right, second? Can I get a second on that? Seconded, okay. Any discussion?
Yeah, Elaine, this is Keith Batman. I have a question.
Okay.
I couldn't hear some of the discussion. This is the purpose of moving this from one budget to the other is what? I didn't hear that answer.
Put it in the right account.
It could be covered under your CFR. I mean, is that,
For mental health.
claim it as
Well, I
a,
think we wanted it in the department, but we're either going to, claim it on the CFR, one way or the other, we claim it on the CFR, but we also have some pending applications for, I guess, some version of disaster funding. Typically, I think it's through CMYCC, the district program, so we're hopeful to get the money for it. It's cleaner that way, I guess.
so if it's an expense in your budget, it'd be cleaner to track and say
Yeah.
we're claiming against it.
Exactly. Yeah, plus it's our stuff, we bought it, so.
And is that good, Keith?
Yeah. I couldn't hear very well, but I caught the gist of it. Yes, thank you.
Okay, yeah, I'm looking at the screen and yeah, okay. All right, did we vote on that, Rich?
Not yet.
Okay, so if there's no more questions about HH7 and moving that expense into the mental health budget, can we get a vote on that? All in favor?
Aye.
Okay, any opposed? Great. Those
Motion
are,
adjourned.
those are the resolutions. Nice try. We do have, Brenda had submitted some information. And I think Brenda's on the line. If there's any questions for Brenda or anything Brenda wants to talk about or clarify. Do you have any questions for Brenda?
Wondering if she has an update on her space situation. I know she's been looking at options with Aileen.
Brenda, any?
Hi, yeah. Hi, this
Okay.
is Brenda. Can you hear me okay?
Yes.
Yes.
Oh, okay, great. So Aileen did do that walkthrough in the basement with me a week or two ago. We had some help from Amy and Harry and Simo, and Paul was involved, and Ed, and I know Aileen was somewhat able to participate. And we did find some really interesting spaces down here in the basement that in all the years I've worked here didn't even know existed. And we did narrow it down to one that seems to be appropriate for office space with some renovation. But as you can imagine, in a building like this, every little inch is used, which means that if we're going to try to accommodate putting people into spaces that have normally been used for storage, we have to do some work on that. And we also then, it's a domino effect that however the space is currently being used, we need to find a new space for that, what it's being used for currently. And so it's a bit of a process that I'm hoping over the next month we can see some movement on it. And we will really be looking to try to resolve this by the annual enrollment for Medicare October 15th. So we're looking to, within the next 3 months, try to get this situated. So I appreciate those folks' involvement, and I'm hoping that we can see some action on this, in the next month.
Right. Any other questions for Brenda? Okay.
I do have one thing that I want to bring up, if I could.
Okay.
Okay. I just want to start a discussion regarding the 2021 budget. As you all know, we had a resolution today to bring in some more funds. Altogether, we've had $250,000 noted through these resolutions that have come into the office for us to provide additional services and sometimes more expensive ways of doing things related to the COVID pandemic. One of the good things that's come out of this is that we have been able to cover some of the meal program expenses that we thought were going to be an extra cost to the county in 2020. We're now able to cover with these federal funds, and that's resulting in some savings to the county in 2020. So that's kind of the good news. The bad news is that I look at making a budget for next year. So far, we are not hearing of any negative impact on our budget. Of course, there's so many unknowns at the federal and state level. But locally, we've been directed to reduce our contractual by 10%. And I just want to explain, so you have some time to consider this and ask questions and ponder this a little bit. Most of what we do is contractual. Our aid service is contractual, our meal service is contractual, the SCAT van transportation service is contractual. If we're asked to reduce that by 10%, please understand that that reduces what we can pull down from the federal and state funding. For every $1 reduction in what the counties got into the budget, reduces what we can pull down by $3. So when we're reducing by 10%, that has a snowball effect on the total amount of money and revenue coming into our office, and it will have a significant impact and reduction on senior services. And so just a rough estimate, I anticipate that would mean serving 25,000 less meals in 2021. I expect that would be 6,000 less hours of aid service, and this would impact well over 100 senior citizens in the county in 2021. And of course, we know they're some of the most vulnerable people during this crisis. Many of these folks are receiving these services because they're near or at risk of placement in a facility or a nursing home. So I'm very concerned about that negative impact, and I will be interested in looking for some input and conversation about where you see those kind of reductions to be made in our community. It's just a great concern.
The request for a 10% reduction in your contracts came locally. You say locally from our budget.
That's the directive to all the departments, that we reduce our contractual by 10%.
Okay, so it's an internal county directive to every department.
Right, yep. And it's just because we aren't able to pull in the federal and state dollars without that county match that we would have such a negative impact on our services.
Okay.
Brenda, what is the total of your contractual line in your budget? Or what's the percentage of the budget that's contractual?
Are you asking the amount? I didn't quite hear you.
Yeah, I'm just curious, how big of a part of your budget is contractual? You said it's primarily, mostly what you do is contractual. Is it 70%?
Oh, it's about half. It's about half our budget.
Okay.
Yeah.
I appreciate you making us aware of your concerns, and I'll certainly be asking about it and looking at it closer.
Yeah, I think it's definitely worth some discussion and some analysis of priorities. Thank you.
Okay. Thank you.
Thank you.
All right. There is Kathleen Cuddy, Health Department, no updates, but I'm sure you have something to say.
I just didn't submit a report. But you'll get one. That's one of the stand where you can hear me, not too close to me. Can you hear me online?
Can you hear Kathleen?
So I really did want to come and say hello to all of you in person. It's been a while.
Yeah.
So the good news is no complaints about the health department. So I'm going to assume that that's, the sentiment of everybody. Ever, Charlie, ever. We're great. And I think we're doing a good job, obviously, in containing COVID-19 to the extent that we are able to. But there's no question people are getting very frustrated. Community people, staff are getting very weary. And we need to make the effort. We need to kind of refresh and reinforce wearing our face covers, keeping our distance, no unnecessary gatherings. And so one of the frequent things that we're doing right now is being asked to help interpret the guidance that's coming out. And as all of you know who follow it, it's constantly changing. Route 90 sale is a big topic of conversation in our county. And overall, we facilitated a conversation that, and I believe you may have been part of it. We met once with towns and villages. We did it again to specifically talk about Route 90. And the majority, but not all, of the supervisors and mayors taking part wanted to be able to say, let's not hold it this year, but it's not an officially sanctioned anything by any one entity. So coming here and saying that is not only the health department has no authority to say it cannot happen, but I'm going on record saying the health department would prefer it did not happen this year. It's an unnecessary gathering of people touching things and densely populated at times and terrible traffic. And so I'm on record with that. And if you agree with that, I encourage you to support and spread the word on that so that it reduces the likelihood of, it minimizes the numbers who will be present there.
So if you don't regulate it, it can happen if.
No, it's not sponsored by the chamber. It's not sponsored by a store. And you are allowed currently to have up to 50 people on your property. Still supposed to cover distance. Whether that happens, I guess we'll find out.
I think most of the supervisors are not allowed.
So, and that was part of what we said, right? We encourage people to spread the word to the people in your communities that you're not in favor of it this year. But not everything, is negative. Swimming pools are open, right? Casey Park, they had some pictures in this, that's good news. Still continuing our weekly calls with the hospital and community leaders. The big thing that we really need to get our arms around is the best way to enforce when there's infractions. And we had some conversations. So for example, Walmart, constantly getting calls, constantly getting calls about people not complying with the guidance. And it's not just people, and when they have a choice, right? Walmart could turn you away and say, don't come into my store, but they're not going to do that. So we need them to make sure, certainly all our employees keep their face covers on. But if you have a medical reason, adult, for coming and cannot wear that, I'm not going to ask you a medical reason, but you should be wearing one. So I should ask you, please put a face cover on. No, I'm not going to, I can't. Okay, please keep your distance. That's what we're trying to make sure they're doing, and that is not happening, and so we want it to. But it's also not happening in small stores. There's a grocery store outside the city to the north of us that's a privately owned mom and pop shop. The employees are not doing a face covering. That's making all of us insane. There's been, when I say all of us, I mean the health department, I mean the sheriff department, I mean the state, because we're getting all the complaints that are going up. So at our Board of Health, we're going to be bringing forward some points for discussion about an option that health departments can take, which is essentially a peace officer type position. But what we're also doing as a community, if we've had a meeting and we're having another one, we've asked the DA to look at the enforcement of misdemeanors if they are issued by the city police or by the sheriff department of the state. Because some of it's just so flagrant that it's appalling. It's for public health, it's not for politics, right? It's for public health.
Oh, yeah, that was the timing. Good. You gotta yell the call about it. Yeah, I don't think somebody called somewhere. Their daughter was. Yeah. Greg? Greg,
Police officers go in and give an enhancement, come to the court and go in front of the judge.
Correct.
That's currently not happening now, or is it? By the Auburn PD or Sheriff's Department.
So law enforcement can issue misdemeanors. They're working with the DA's office to say, how are we going to enforce this? So before we issue that initial ticket, we're going to make sure we know how the process is going to roll out. Yep. So that's what we're doing currently. Through public health law, there are some options that we're still learning more about it, about hiring public health department peace officers who then can go in and issue a citation. And it does that citation, then it probably goes to the
board,
hearing officer, not
the board of
to a
health,
judge.
not right. Oh,
Yep.
boy.
Hearing officer and then to the board.
Either way, it won't be popular at all.
No. So I have my opinions as public health director. I find it's an inconvenience, but it is so much better than being sick, and it's just adult behavior. This is no big deal to put on a face cover. It's no big deal to stay 6 feet apart. It's very attainable, it's very doable, and our children will follow our examples. So we should do it. So that's some of the, the hot topic action, but I think related to the resolution that is currently, I haven't given you a lot of data, right? We've got data, but it takes time to put it all together, and it's constantly changing, right? Every day more. Right? But I'm putting together some quantitative stuff, and so I'm just going to hit a few highlights. And what I guess I'll ask of all of you, if there's particular information that you are interested in, let me know, and maybe I can pull that out more. But just going back to, mid-March is when things really blew up, but it was absolutely the beginning of March and end of February when we started taking activity in the health department, more so pointed around COVID. But in the last few months, we've issued 127 press releases. We've specimen collected 1,717 people. We've had 128 people in isolation, 388 people in quarantine, 35 people in precautionary quarantine. And so when I say they're in isolation, just to give you a sense of what that means, it means not only was the person tested positive for COVID-19, it's then reported to us through the lab system, and then we take action. So we have an intake assessment that's 2 pages long that needs to be completed, and that takes about 30 minutes of conversation. And then there's education that goes on, like how do you care for yourself when you're home if you're sick and you have other people in your home? And how can I prevent my household members from getting this illness? Then we have daily monitoring, delivery of the public health orders, daily drive-by visits, discharge papers, conversations with employers if they need it. Quarantine is very similar. The ongoing visits are not as detailed. And we've certainly had situations also, when I talked about the number of clinics, those were the clinics we held that were drive-through, but we've had situations where we went on site to farms and to other workplaces where people did not have transportation, and we performed the specimen collection there. Those weren't included in these numbers. We did just about 35 people today at a farm, because where there's one, there's often more. And many people live in more congregate settings there, and we want to try and address that. We're also seeing more, and you probably are hearing this in the news also, we're starting to get some positives in facilities. So it's workers in facilities, but we've had some residents in facilities. And that's obviously something that needs to be hopped on very quickly to help prevent the spread. And it takes quite a bit of time. So on a Saturday night, you get a call, there was a positive, came back, the facilities are letting us know right away, which is excellent. And on the whole, they really want to do the right thing, right? We've had some challenges with one facility, but we are and have addressed it. So you identify if you're a worker at a facility and the administrator got your test results back, or you got your test results and you're positive. A lot of times it's the doctors, or because we check twice a day and download the new positives. But if something comes in overnight and your doctor gets it and informs you, great, you're going to call your boss right off because you care about the people you work with. So they've called us, or if they've gone to the hospital calls us. And then we start the contact tracing immediately with the other healthcare providers and the patients they've been in contact with. We do that anyways with families, but we drop everything and do it immediately with healthcare facilities. We've transported people. We didn't have transportation because you don't want to put someone who's getting discharged from the hospital in a taxi cab when they're positive, because now that taxi cab driver is going to have to be quarantined. So there's a lot. We've done some on-site educational sessions as well to work sites. Certainly, almost all the county departments have requested we get involved and provide some education and walkthroughs, but there's been a number of businesses that we are working with. And a lot of education.
And that's hard to hear.
Okay.
Yeah.
Well, now that I've babbled for the last 10 minutes, I don't think everybody wants to hear me repeat myself, but I am putting together a report that will quantify this better, because I'm not certain that all of you have an appreciation for how much we're doing, and I want you to. I want you to.
Yeah.
That's it.
Okay, go ahead.
Oh.
Speak up though, because you're in the back of the room. They say it's
Our
hard to hear.
microphone's over here.
You have a COVID testing clinic going on next Tuesday?
Yes.
Is that at the health department?
No, you have to register online for our COVID clinics, and we're doing the drive-through clinics still. And so we hold those away from the health department in a drive-through day, which is really not a secret anymore. It's at BOCES, is where we do it. In the drive-through day.
I asked that because a number of people are trying to get online registered, and it doesn't allow you to register. Is there a phone number they can call?
Yeah, certainly anyone can call the health department and we'll help them if they can't link on. When our Tuesday clinic gets full, the registration won't let you register it, and it gets full.
Well, that could be the,
And we don't make it live until Thursday. So after our Tuesday clinic is done, so how many did we have? And then it's the process to go through to set it up to go live again on Thursday. So if someone was trying Tuesday afternoon or Wednesday, they are hitting enrollment.
which is the number 253.
253-1560. But there are also other sites, and so that's what we're telling people if they're frustrated,
Right.
because right now we're doing it once a week, the testing.
You just sent a nice
We've got
press
others.
release that linked to Onondaga County and Tompkins County and your site.
Exactly.
Yeah. It's good, nice.
Those are the ideal to go to the drive-throughs. They're really quick, really efficient, and
Yeah.
don't cost. You can go to an urgent care center also. You should call it ahead. And I'm going on record to say we prefer you not use Well Now because they take so long to get us the results. And they haven't populated. Right.
How long is it taking you guys?
What does it?
There is no cost to a person going to one of the drive-through clinics, either at Cayuga County, there's no out-of-pocket cost to them, or to Syracuse, or to Ithaca. But we do ask for your health insurance because the laboratory doing the analysis does bill your insurance, but you will not get an out-of-pocket charge.
Okay. One more question.
Never mind. I'll wait.
Next month, later next month, I think, Twisted Fence has a runabout or something, down south in the county. They were already done it out in Schuyler County. Next month is supposed to be up here. They haven't got the permission yet. They're supposed to get with the highway to get that closed down. It's an annual event they have. They have all the booths and everything to keep everybody separated. So you might be seeing a request to allow them to do that. I don't know if you're.
I'm not familiar with it yet, but we'll certainly be on the lookout for it.
I'm just mentioning it to you because the other two counties that have already done it, the health department did allow them to do it. So I don't want you to be surprised if you see it.
I'll be surprised if I get noticed 2 days before the event.
Oh, no.
But I get it before then.
We're talking,
Yes.
late next month or September. Just wanted to let you know.
Great.
Someone else have a question? Any other questions for Kathleen? All right.
Okay, great. Thanks.
Okay, all right. Ray, with a lot of information.
Do you guys have any questions about the report? Happy to answer.
Well, I had sent a couple things that I was hoping you could clarify.
Sure.
Okay.
Would you like me to start with?
You could, I had a question about the NAACP and the training. I was unsure what you were.
Well, I went and spoke at the town hall meeting that they had at the tourism place on Genesee Street, and part of my comments were related to, there's disproportionate minority contact in the juvenile justice system, and there's implicit bias in the foster care system, and we provide a lot of benefits to the community and, mental health services and substance abuse services. There's a lot of stigma and there's all that sort of stuff. So I said that we would participate, like the leadership team at the departments would participate in any, like if they're going to move forward with some sort of planning effort and some sort of work around trying to move the needle, that I'm just putting the department's resources at their disposal from that perspective. I'm sure they're going to do some stuff. So they said they'd let me know when they were ready to do that. And there's work that we can do for sure.
Include your department in.
Both mental health and Department of Social
Okay.
Services. We want to be part of the solution. So there's stuff that we can do that's different.
Okay.
Actually, the Department of Social Services, OCFS, has made some implicit bias training available online. So we're having everybody do that. And I just think we can always. Sometimes it's nice to look at it from a different angle about how people experience us.
Okay.
That's what I was talking about. It's just some general comments.
Okay. Any questions about that?
Yeah, Elaine, this is Keith.
Hey, Keith?
I don't know if it's a request more than a question. I think any training, absolutely any training we can get related to the inherent implicit bias and so on is really good. And anything the state does specifically for any of our departments designed for those professionals is really good. One of the things that concerns me is that we make certain that we have a county response and not a department by department response. This problem is a county problem. It's not DSS problem, mental health problem. It's sheriff's problem. It's not probation problem. It's everyone's problem. And the only way we're going to really have an impact, and Ray said this at his comments, one of the comments Ray made at that session was the one-off trainings may be good, but they're not the solution. And so we need to make certain that we're having a county-wide response to this, and we're not doing it piecemeal, department by department. And so that's my request is that we make certain that we're coordinating that through through someone that we've got to decide who that is. But it's critically important that we all pull together on this. That's it. Thanks.
Yep.
You guys should get like a second speaker.
I know.
Or put it in the middle of the room. Just plugs, I think.
You, I thought there was interest, especially on my part too, that you had sort of indicated that you were kind of giving us a heads up that in August, some additional resolutions might be coming forward. One around the Grant Ave shelter operated by Chapel House and increasing the rate. I don't know if that's a per diem rate or similar to Chapel House on Franklin Street.
Well, it's different. So it's a
Okay.
5-year, it was a
Okay.
5-year contract that we entered in, and it expires in August. So
Okay.
that has to be renegotiated. That's paid for differently than Chapel House. I mean, a lot of you guys weren't here when we did this. This was one of the first 5-year contracts that the county had written, because we wanted to make sure that the agency was going to be made whole because they were purchasing the property.
Right.
So the way that contract was structured, and you know what I'm talking about when I talk about backing into something. So, and the regulations have changed now. And we met with them this week, and I'm hopeful to bring the resolutions in August, but I'm not sure that we can figure out how we're going to do this. So OTDA was here last week inspecting shelters. So now all shelters now need to be inspected. There's no more uninspected shelters and all of that. And they promulgated and put out new regulations. So we can, we got to get out of the hotel business as much as possible. This is awful, the stuff that's happening in there. It is awful, and it's just awful. So we can increase the capacity at that place to 20.
Green
Right?
Ave?
Yeah, 16 now. So trying to figure out how to increase it. So increasing it, so then there has to be staffing. There has to be overnight staffing. There's overnight staffing at Chapel House. There has to be overnight staffing at Rolls too. So that doesn't currently exist. They don't have that. We didn't have to do it before because when that place opened up, those regulations didn't apply to it. Also too, it's based on occupancy. So we also want to, so this was out of the meeting that we had, that idea of, and we talked to them about this, being able to take over the on-call for people when they call after hours who are looking for emergency housing, so they have to present someplace.
Yep.
And be interviewed and all that. So that's something that we have to do.
That's part of this as well. That's great.
But we try to roll it all
Yep.
in. We learned, and I didn't know this, and I don't know why this wasn't explained to me, but so I learned the other day, from Lynn, that the claiming for the case management contracts, we're not for something. I got to look into this anyway. So I have to talk to OTDA. So there's some thinking in the department that we should roll the case management contracts into the rate, because from a claiming perspective, that's supposed to be better for us. So that's part of what we got to figure out too. I also want to collapse all of the case management. So that contract that you just, the extension, for the family I want to roll all of it into one provider because that makes a lot of sense. You're not paying overhead, and then you can, over time, they can get really specialized in that. So trying to figure that out is going to be a lift in terms of one, what does it look like? What's it cost? Can we push? You got to talk to OTDA because they have to approve the rates and all of that kind of stuff. And going back to the, so I'm agnostic about about who gets contracted to do these ILP visits in the motel. They're not happening now. It is a requirement to enforce ILPs. We stopped doing it because it was unsafe. People were threatening the workers. People were very aggressive. There's a lot of drug use. There's a lot of dealing. There's a lot of trafficking. There's a lot of people coming in and being in the rooms and not leaving and can't enforce it. And the police won't enforce it as part of their regular work. Try to get them to understand I'm the owner of the room, not the person who's living in the room. If I ask you to evict them, you will, they won't. The reason to contract with APD was only because they're all in the city, and I could care less. And I might roll that into, I want to do those ILP checks because if we're not doing them, then we can't sanction somebody for doing that stuff and they remain collecting benefits when they're not supposed to. And we don't want to give benefits to people who are breaking the rules and behaving that way. Got a lot of complaints, Weedsport PD, Auburn Police, motel owners. You guys don't understand how every day it's hassle after headache after crazy stuff that's going on, and we have no response for that. So I thought about rolling all that in either into that contract and having them do that stuff. So that's what the conversation is shaped up to be. You know, put all that stuff on the table for those guys. You know, they're sort of thinking about it.
You call Michael in?
Pardon?
So they're sort of thinking about it, and you know, we're gonna meet again. I'm hopeful to bring the resolution and the resolutions or however I don't know what it's going to look like. So you're like in the very beginning of our thinking as well too. I don't think we'll get it done for August. I was hopeful, but like the more that we talked about it, and then so it becomes more complicated, and then also too with this claiming thing. So that's just what we're going to figure out. So that contract's expired, will expire. So that's part of what the thinking is. So that would increase our capacity to 39 shelter beds. You know, the 19 over at Chapel House, and then the 8 units that we have for families over at Family Transitions on Merriman Street. So that should get us. I mean, that'll take like 4 more people out of motels. Not a lot, but might as well maximize it. It's still dicey anyways, because some of the rooms there'll be 4 people in a room in 3 of the rooms. That's not always. I also asked them to explore, looking for a space to do like for Code Blue, where we can dormitory style people in cots, and it's the Code Blue business in the motels. There's no sanctioning. So people can do whatever they want, and we can't do anything about it. So if they're in a place that where we can bunk people that way, there would be supervision. That's 100% money, the Code Blue money. Might solve some of the problems, but it's going to continue to be a problem, and there's going to continue to be a lot of bad stuff happening, and it is a public safety issue. It's also a moral issue. Kids get hurt, women get hurt, people get taken advantage of. It's just, we can't really accept that anymore, I guess.
If I'm in a hotel and I have a hotel check and I have a guest or I'm violating my independent living plan and that's determined, the department gets notice and I'm sanctioned for a duration?
Durational sanctions.
Like months?
Depends. I don't, off the top of my head, I don't know. I can
So,
ask you I can find out and tell you what the durational
Yeah, I'm not going to
sanction
be
is.
housed again until my sanction's over and then I go back to the 3rd floor and it starts again.
Right, except in Code Blue. There is no durational sanctions.
Okay, all right.
So we're not enforcing that because,
Right.
for a number of reasons, and I'm not sure that, so I would just prefer to contract all that stuff out, I guess.
Gotcha.
So you'll hear more about it.
Okay.
That's just the beginning thinking. So I'm just giving you a heads up, and
Okay.
again, I can't, normally I can see a way to do something, but I'm sort of stuck trying to figure out how I would bake this into a rate. Because the rate fluctuates based on the census, unless you back into it, and I don't know if we'll be able to do that. So I would prefer if we could keep, they could be separate contracts, because it's easier to manage them one that way and also to fund them without getting into this business of the business that we have to get to on the claiming side to sort of make it all happen. So and there's difference of opinions in the leadership team about how to do that right now. So we'll work through it.
And I had an offline conversation with Ray. He referenced the cuts in his state aid.
Yep.
Mental health state aid was cut by 20%. Oasis funding was cut by 20%.
31 actually.
30?
Yeah, like they said 20, but the state aid letter had a 31% cut in it.
But your goal, if I understood correctly, is the mental health state aid that you're passing through to various organizations. You're hoping to not really impact those organizations with that cut.
Right.
To try to do something to minimize that?
Yeah, so it annualized, it's altogether $400,000 in cuts. All the Oasis state aid goes to agencies.
Right.
Some of the mental health state aid we keep in the clinic. So, we're talking, so the Community Services Board sort of decides, how this stuff gets allocated. So we'll be having that conversation kind of at the end of the month. So my thinking is, we have, just the other day I got, I don't know, $150,000 in district funding for the value-based payment stuff that we're doing, and we're doing pretty well financially. So I'm thinking that in OMH today, I had a conversation with them, and they're going to give us all the counties sort of broad latitude on how to sort of manage the reductions. Because when you get the state aid letter, it has the reductions percentage-wise across all the program codes, which if you did it that way, then everybody would, take the cut across the board. So that's the annualized cut is on the mental health side, $250,000. We had issued an RFP and made an award to Liberty Resources to do adult respite. And I used some of that money to pay for the house that we rented to be able to sort of manage anything that would happen, and in terms of related to the COVID and all that stuff. So we have about like $80,000 of that unspent state aid that hasn't been allocated, so that we can knock the cut down in the annualized cut to like $170,000. I think that I can make the agencies whole and cover that with our state aid, pay them with the state aid that we embed in the clinic, and I think it's not going to hurt us. I'm positive it's not going to hurt us at all. We can do that for like the last 2 quarters of this year. I don't know about 2021. I have to look at that when we do the budget and all that sort of stuff. And we don't know what's going to happen. We don't know what's going to happen in terms of the calendar year 2021. We have no idea how that's going to look. My expectation is that they're going to probably pick funding codes to put the reductions in specifically. They're hopeful, they say, that if the state receives any stimulus money, that they're going to restore those reductions. Whatever. I mean, sure. I'm sure the dormitory authority wouldn't get it all, and they're going to go fund the programs that they cut, restore. So I don't see that. On the Oasis side, I have flexibility on how to apply those reductions. So it funds the Oasis money funds some of the clinic operations at CHAD, the prevention program, and it funds Grace House, which is a halfway house for substance abusers. The prevention program is based kind of in schools, so there's been no school. So, again, I'm going to come to the Community Services Board with some thoughts about how we can apply this, and then vote on it and then do that. I think that CHAD recently, Judge Thurston is starting the it's an opiate court, but he calls it something else. I forget what it is. And there was $150,000 that was available for that, and I split that between Nick's Ride for Friends for the peer services and for CHAD he's getting $75,000, which I think would help him manage any kind of reduction in state aid. So I don't think it will be as painful as him. I'm a little concerned about Grace House because there's not a lot of room. There's no other way for them, like they don't have any other funding sources that they can sort of like, like you push more visits in the clinic to get some more revenue. They don't have that ability to do anything with their operations other than cut staff, which would be an issue in terms of, providing the support for the residents and all that sort of stuff. So I'll put something out, hopefully try to get something out. Because I still got to get like clear guidance from these guys, from the agencies, the state agencies about how much flexibility we have and all that. And also the regional state aid for mobile crisis is taking a cut as well too. So we got to figure that out with the regional group on. It's just a terrible time to be making these cuts because the work in those two agencies has just jumped significantly because of the pressure. Like, I mean, right, Kathleen, you would agree that the lid is starting to come off in a lot of different ways, and so those are the agencies and those programs that really help. So, who wants to say? Yep, lid's popping.
And it's not stopping.
No, it's just going to keep ramping up, and the school thing is going to be a concern too because I don't see it being anywhere near what it used to be. I don't know what it's going to look like, but it's not going to be what it used to be. So they'll just keep the pressure on families and stuff like that. So I don't know if you had any other questions.
Did you guys have any other questions? I had. Sure. Your report mentions foster care placements.
Sorry, what?
Your report mentions foster care placements are increasing right now.
Oh, yeah. Yeah.
Is that like, are those referrals, like, where are those increases coming from, do you think?
So, well, it's neglect.
I mean, like who's calling them in and stuff?
So what happens now, well, I mean, anybody can call them in. I think what's missing is the school reports.
Yeah.
So from a volume perspective, the calls are down because you don't get a lot of, the kids not going to school sort of stuff.
I guess that was my question. The school's not going on. Like, where are these coming from? Or just
Police.
You're just starting to see more trending.
People that see it now as folks are moving more out of their home. We always get complaints. We always get allegations. I just think that the ones that we get now, the numbers are down, but by the time they get noticed, they're pretty serious. So there's an awful lot of, so there's domestic violence stuff driving a lot of it, and substance abuse and mental health issues driving a lot of it. Houses that are pretty deplorable. A lot of the stuff that, we also haven't been going into homes as regularly as we had been in the past. Although, so our guidance in terms of how home visits go, sort of adjust as the, sort of track what happens nationally in New York State and in the county in terms of what's happening with COVID and all that. So as we get out more and more and go into homes more and more, we start seeing some stuff. So it's hard to predict what, they just come from people calling the registry. A lot of law enforcement complaints based on stuff that they respond to like that. So yeah, the numbers are up. Removals are up. We still continue to place a lot of people with relatives when possible. That's helped us a lot. But we were in the low 70s for a long time. I think we're up in getting close to the high 80s now in terms of kids in our boarding homes and also in the treatment foster care run by the agencies.
Keith, do you have a question? Or Mike? Somebody?
It's so weird. You're there.
Your hand
Sorry,
up.
he was muted. Yeah, forgive me. This is Keith. I did have a question. And that is, I'm really glad to hear that there's an effort to the kind of buffer a little bit the impact that the 20% federal or state cuts are going to have on not-for-profits. Because the thing that concerns me is that if whomever actions there are, whether it's the state or us or the federal government, whatever actions people take now, if those actions have consequences later, what it means is that even when this crisis is over, we will have destroyed our community not-for-profit infrastructure, which will be, potentially disastrous. So I'm really glad in that. And I'm really interested in, I don't want to take time now, but I'm really interested in the kind of the, not exactly the detail, but a little deeper dive than maybe some other people are. And I'm wondering who's the best person to reach out to really have a conversation about the possible impact on our not-for-profit community. Who might I reach out to?
United Way.
Yeah, we'll be,
Add into that question.
Go ahead, say it.
I was gonna say, the United Way, will be
No,
coming out.
I'm talking about Cayuga County's the stuff we can control. I mean, that's good. I will follow up with them too, but I'm really interested in what we do as an agency, as a county government, to do. And so I'm thinking internally. I'm not sure who the best person is to reach out to in terms of the finances.
I'm a little confused. You want to know what potential impacts our contracts are going to have because of this, and
Yeah, that's
on the not-for-profits?
Described it. Yeah.
We contract, so I talk, I mean, it's not formal, but I mean, I talk to the agencies all the time, and I think they're gonna, you're gonna start seeing layoffs. They're deep into their lines of credit. The state stopped paying contracts. This cut doesn't help. I mean, a formal way to sort of survey them, to ask them what's going on. I mean,
but we're not impacting them, I guess is the question, right? Or you're not at this
yet.
point in time?
Not
right
yet.
now, you haven't impacted them.
Well, we make some small adjustments here and there, you know what I mean, but like I've given them all the flexibility with the state aid. So like on the programs that they weren't able to operate because of this, they were allowed to allocate that state aid in their agencies in another way, instead of saying, because we could have legitimately said,
give it
okay,
back.
so you're not doing this, I'm gonna take this state aid back and I'm gonna reallocate it someplace else. So we tried to, do what we could, and I think we've been pushing the money out quickly. Grace and her staff, try to push the money out as quick as they can up there. We got to push, I don't know, $3 million into the nonprofits in terms of the contracts between two agencies and all of that. So it would be, I think it is work. I mean, I think that's a valid concern. I don't know if anybody's really, I don't think there's a coordinated effort to try to understand, the depth of the impact, how severe that's going to be, and whether or not they can recover or not.
Exactly.
Credit, and
it's recovery, really. That's the issue. The short-term pain is pain. But yeah. Okay, well I guess you've answered my question. I didn't even though you may have said that, I guess I didn't hear it. So far we have fundamentally, to the extent that we can control contracts and issues and so on, we've held everyone whole so far then.
Right. You don't know what's going to happen next year, you're saying.
No, of course.
No.
Yes.
I don't know what they're. It's important. I ran a nonprofit, and if a recovery comes for them in like restoration and stuff like that, you still can't climb out of a couple $100,000 in accounts receivable or accounts payable checks that you had to hold, and a line of credit that's maxed. There's no way. There's just no way. If you're a well-capitalized agency, you can. I don't think that a lot of them here are.
No, not-for-profits in general aren't. Yeah, and that's exactly my concern. So, yeah, thank you.
For sure. We can. I mean, I'll keep you guys posted on that. You know what I mean. But our intention is to really try to not hurt them.
I would just piggyback on that too with the work we've been doing with the United Way. We will be coming out with an interim report that does look at some of the impact that the nonprofits have experienced.
You guys could survey them too. And
they have been
okay.
surveyed.
If you get stuff, I'd like to. You can share that. I'd like to kind of know.
We'll be putting something out soon on that. Part of that is looking at opportunities for different service delivery models. And just to revisit the conversation about the homeless,
And I know pre-COVID, we had kind of started a work group to look at that problem, which is continuing. And I think I would love to revisit that with you, Ray, and Elaine, maybe sit down and have some conversations about it and look at possibly continuing that effort because the problem isn't going away. And I think we need to focus on it and think about alternatives and look at different ways that we can address the problem from the community standpoint. I think it's a bigger problem than government can solve, and the solutions maybe
It's not
needs to
solvable,
be
it's manageable.
come through the community. And I mean, even like the churches and stuff, I know at one point they were involved, and so we
Right.
would love to revisit that, get it going, and really put some time into it from the legislative standpoint and supporting you working through those problems that your department's managing.
So you just reminded me, the moratorium on evictions is lifting. We've got a OTDA pushed out. There's a call next week to talk about strategies to prevent evictions, which I don't really know what that is. I was just reading, they're making $325,000 available to us. I don't know if that's going to go through the continuum of care, which I hope it doesn't, because that gets diluted. So we have quite a bit of money in the, wow, I'm blanking out on this name. We do this, we get money to do like rent subsidies and pay arrears and stuff like that. We haven't had to use that money because there hasn't been any evictions. So that we do have a little bit, we do have a little bit of a cushion to sort of blunt the impact of that, I think, which is, so I'm trying to understand that a little bit more in terms of how we can do that, but that's going to be a worry.
I heard today too that I think it's HCR is coming out with a rent assistance program that people can apply to directly for one-time payment. But there's a short window.
Yeah.
I think it's maybe the last 2 weeks of July, and the guidance is still forthcoming on that. But
Yeah, we're getting guidance to death.
yeah, I think there's temporary supports in place right now to keep things stitched together, but as you said, things are really starting to come off, and as those supports run out, it's going to be even more important that we're all working together on these solutions. And so I think if we can set up a meeting with you, that would be great, and continue the conversation and get more people involved in that discussion. I'm glad to hear there's prevention money. That's awesome. $325,000?
I think so. I mean, they just
significant.
pushed out the LCM today. I was reading it over there. To decode this stuff, takes a little bit of time.
Yeah.
But yeah, they did, so $27 million has been allocated to New York State for this, and they split it up among the counties, so.
Okay, anything else? Before we adjourn, Tim Lattimore asked if I would bring to this the attention of the committee, would there be, he's been talking about this for a few months now, any support to draft a resolution asking that services such as Alcoholics Anonymous or support for substance abuse services, if we were to be in a crisis again, be considered by the state as essential and be allowed to remain open. So if you wanted me to bring that forward to see if there was something put together with that sort of theme, would there be support from the Health and Human Services Committee to move it forward?
I would definitely support that. And I guess my question is, like, what phase is that considered? What phase was AA? Did it come in?
Like peer support?
Kind of later in the process, or?
I have to go back. It was before the most recent. If you get back, technically 3, I was going to say 2 or 3.
And I think his point was because the impact of not having those supports. So could the governor consider, if this happens again, that those services be considered essential and allowed to remain open?
From a public health standpoint, could you do it safely?
Right, it depends. We're never going to have an emergency like this again, but it's not over. Right? not in our lifetime.
I know, liquor
But
stores.
I think depending, it should be considered because they are what sustain people.
What were-
I said liquor stores were
Exactly.
considered essential, they never closed.
Alcohol and opiates considered
Yeah.
for.
Elaine? Elaine, can you hear me?
I can.
I can't imagine anyone's opposed to doing something like that. My only caution would be that it be worded not specific to AA or NA or anything which is exclusive, but that we call upon the governor to recognize the importance of the continuity of mental health, the drug alcohol treatment programs, the essential natures of those, and approach it that way, which is a little more generically, perhaps, than calling out specific programs, but it ensures that we don't leave something out, and it gets at the idea, which is, I think Tim is absolutely right, that the people get cut off.
Yeah.
That's a disaster, and that's what we don't want. And just so, yeah, that would be my only caution, that it be worded carefully.
Okay, sounds good. Thank you. All right. Anything else? Want to now motion to adjourn?
Motion to.
Let me motion. I have motion. This is Keith. I motion to adjourn.
Yeah. All right. Thank you.
All right.